People trying to become pregnant may hear a lot about luteal phase deficiency or luteal phase defect. What is it? What causes luteal phase defect? How do you test for it? What is the best way to treat it? Stay tuned. There are two parts to the menstrual cycle. From the time of the period until ovulation is the first part, and it is called the follicular phase. The second part is from ovulation until the next period and is called the luteal phase. During the follicular phase, the ovaries produce estrogen, which thickens the uterine lining. During the luteal phase, the ovaries produce a huge amount of progesterone, which transforms the uterine lining so that it can allow an embryo to implant. A luteal phase defect is defined as some problem that occurs during the luteal phase that reduces the chances that an embryo will implant or increases the chances that an implanted embryo will not develop. How do you know if you have a luteal phase defect? One method is to determine the length of time from ovulation until the next period. Implantation of an embryo usually occurs 7 to 8 days after ovulation. If you're getting your period less than a week after you ovulate, then you may have a luteal phase defect. Remember that your cycle can vary from 1 month to the next, so it is likely only a problem if the length of your luteal phase is persistently short. Blood testing to measure progesterone levels is often recommended as a test for luteal phase defect, but this is notoriously unreliable. This is because progesterone is produced in pulses. As a result, progesterone levels can fluctuate nearly tenfold within 90 minutes. In other words, what seems like a low progesterone level at the time you had your blood drawn may have been much higher if your blood was drawn an hour later. Check out this video to learn more about what your progesterone level could mean. In the past, some doctors recommended doing a biopsy of the uterine lining and then looking for certain changes under the microscope. Unfortunately, this is unreliable also. A few studies have found that up to half of women with normal cycles will show abnormal results. No difference was found between women with infertility or normal fertility. There are several conditions that could cause a luteal phase defect. Make sure to have blood tests such as a TSH to check for thyroid problems and prolactin to look for abnormal elevations. Luteal phase defects are also seemingly more common in older women and in women with very low weight or who are overweight. Treatment for luteal phase defect uses medication to either add more progesterone directly or trying to get the body to produce more progesterone. What about natural methods for increasing progesterone, like changing your diet, taking vitamins, or exercising? I actually did an entire video about this. Check it out after you are done with this episode. Progesterone medications for fertility contain the type of progesterone that is identical to the kind made by the ovaries. Progesterone can be given orally as a pill. However, much of the progesterone is destroyed in the stomach and broken down in the liver. Only about 10% of the progesterone taken orally is absorbed intact, so oral progesterone for fertility is not recommended. Progesterone can be given as an intramuscular injection. Injections of progesterone give very high levels on blood tests. The problem with progesterone injections is that it is a thick oil that has to be injected into the muscle. This is fairly painful and sometimes causes welts and rashes. Vaginal progesterone products such as Crinone, which is an ointment, or endometrin, which is a tablet, produces lower blood levels compared to injections, but more of the progesterone ends up in the uterus, which is where we want it. The biggest problem with vaginal progesterone is leakage. While this doesn't affect how well the progesterone is absorbed, it can be messy to the point where you may need to wear a pad. Finally, there are progesterone creams, which are meant to be applied to the skin. A few problems with these. First, since there are no commercial preparations of progesterone cream, it has to be made from scratch. Quality control is more difficult, so there is a lot of variability in the amount of progesterone from dose to dose. This is also a problem since it is impossible to always squeeze out the exact same amount each time. Finally, differences in the thickness of the skin will interfere with reliable absorption. Creams are therefore not recommended. Other than giving progesterone, fertility medications like Clomid have been used to increase progesterone production by getting multiple eggs to develop. The follicle where each egg develops is what produces progesterone, so having multiple sources will raise progesterone levels. One final point. It should be noted that if you are trying to get pregnant naturally, there are no studies which show that treating a luteal phase defect will improve your chances for conceiving or delivering. So ultimately, none of this might be very helpful. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.